As part of efforts to encourage exclusive breastfeeding, a training of trainers on maternal, infant, and young child nutrition and baby-friendly hospital initiative has been conducted in Kogi State. The training was organized to enlighten health workers that will in turn enlighten those at grassroots level on the need for exclusive breastfeeding by mothers. Kogi State Project Manager of the Accelerating Nutrition Results in Nigeria, Bolarinwa Oladele Ogundosi, said the need for the exclusive breastfeeding cannot be overemphasized, calling on mothers to pay adequate attention to breastfeeding their newborns. Joshua Adinoyi has the details.
Exclusive breastfeeding is the practice of only giving an infant breast milk for the first 6 months of life without other food or water. In Kogi State, statistics of 2021 shows that the practice is at 34.4%, hence the need for the training to be organized, aimed at sensitizing expectant and nursing mothers on the importance of exclusive breastfeeding. Some resource persons, Bolarinwa Oladele Ogundosi, who is the Kogi State Project Manager of ANRin, and Patricia Medukmi of the Federal Teaching Hospital, Lokoja, said exclusive breastfeeding is key towards ensuring better health for children, calling on mothers to desist from using supplements within the first 6 months of giving birth.
The mix survey of 2021 shows that we are at 34.4% in exclusive breastfeeding. We are trying to make sure that we increase this percentage to at least 52 in the next 12 months. So we are trying to make sure that our health workers help us, even during antenatal visits, and even at support groups in the villages at homes, to make sure that mothers exclusively breastfeed their babies, and to also orientate them to know the importance of nutrition, to know the importance of breast milk, and to make sure that children are exclusively breastfed.
Breast milk itself, number one, is the ideal food for the baby. Contains everything in the right proportion, everything needed by the baby for optimal growth in the right proportion. It protects against diseases, both during childhood and even later in adulthood. Diseases like allergy, asthma, some form of cancers, obesity, and all those stuff. Exclusive breastfeeding has been said to protect against such. And it also reduces the rate of infant death.
Participants: Isa Salihu, who is the coordinator, Nursing Services, Kogi State Ministry of Health, and the Maternal and Child Health Focal Person, Kogi State, Dr. Hadiza Ismail Ahmed, described the retraining exercise as timely, promising to play their part by disseminating the lessons learned to those at the grassroots.
It has been established from research that those who are exclusively breastfed, after or when they are injected into schools, they perform excellently, and when they grow physically, they are up to date.
We know that we should initiate breastfeeding in the first 1 hour. It has been changed to be within the first 30 minutes, and try to reduce the use of breast milk substitutes. We might get the companies trying to get our buy-in in different ways. We've been taught on those ways and how to mitigate getting initiated. It's been an interesting one, and we are learning. We are supposed to go back to our communities. Let's not leave out any health institution.
Health workers at the training were also advised to seize all opportunities to educate expectant and nursing mothers on the importance of exclusive breastfeeding to eradicate ignorance of it in the society. From the event hall of the Hilltop Hotel, Lokoja, I am Joshua Adinoyi, reporting for MLC TV.